Hi students, this is me Dr. Aditya Tiwari once again, and in this video we'll be talking about memory disorders. Especially we'll try to know what is orientation, what is amnesia, and what is korsakoff syndrome. My videos are special for USMLE students and also the NCLEX students. If you go through my videos, and then you won't need to go through the first aid book again. Okay, so let's start it. So memory disorders. So orientation means knowing who you are, where you are, and what time or date it is. Okay, the usual whenever you say that the person has loss of orientation, the first thing to lose is the orientation in response to time, and then the place, and then finally the person. Okay, so this is somewhat necessary in real clinical experience in life. Okay, and this is that common cause of loss of orientation includes alcohol, drugs, fluid or electrolyte disbalance, heat trauma, hypoglycemia, infection, nutritional deficiencies, and hypoxia. Now let's learn what are amnesias. Okay, there are two types of amnesia, that is retrograde amnesia and anterograde amnesia. Retrograde amnesia means again can't remember things that happened before the brain injury or CNS insult, whereas anterograde amnesia means can't form new memories after the brain injury or CNS insult. Okay, and now let's learn about korsakoff syndrome. This is important. So korsakoff syndrome is a severe mental disorder caused by thiamine, that is vitamin B1 deficiency, most commonly seen in chronic alcoholics. So we know these things. Neuroanatomy: the mammillary body and anterior thalamus are damaged. So in korsakoff syndrome, the mammillary bodies and anterior thalamus are damaged. These are the brain's memory relay stations. So we have to understand that in what part of the brain is affected in korsakoff syndrome, and the answer is mammillary body and anterior thalamus. Clinical context is that so korsakoff syndrome is late chronic stage of wernicke encephalopathy, and again it's seen in chronic alcohol use and vitamin B1 in vitamin B1 or thiamine deficiency. Characteristics features of korsakoff syndrome is confabulation, means the patient makes up stories or memories without realizing that they are wrong. They genuinely believe what they are saying. Okay, so this is korsakoff syndrome. In korsakoff syndrome, we have to remember three things. It is let's say a sequel or the chronic stage of wernicke encephalopathy. As korsakoff syndrome is linked with vitamin B1 deficiency or all chronic alcohol use. Mammillary bodies and anterior thalamus are mainly affected, and the symptom is confabulation. Okay, so now here in this video I have added some USMLE style practice questions. I want you to pause the video and go through this so that you get a somewhat understanding of everything. Okay, so these are some USMLE style practice questions. Here the answer is inability to form new memories with fabricated stories to fill memory gaps. Here the answer is retrograde amnesia, and here a time, place, and person. So I want you to go through this, and if you're a nursing student, I want you to go through these nursing related questions. Okay, yes, pause the video and go through this. So, and then we'll see you in the next video. Okay, this video was short because we just dealt with korsakoff syndrome and a little bit of amnesia. See you in the next video. Bye bye.